Doctors in Italy's northern region say they are at war for a third time with the latest wave of coronavirus infections inundating intensive care units with patients. Highly contagious variants are to blame for the latest spike, with more than 20,000 new cases and 500 deaths reported on Tuesday. Correspondent Hermione Kitson reports.
Within the ancient walls of Chiari is a crisis that's reflected across the region of Lombardy. Hospitals overflowing 1 year after it was the epicenter of Italy's first outbreak of COVID-19.
We are tired, also because the mode in which we have to work is extremely difficult psychologically. It seems an eternity has passed, not 1 year.
The Melino Malini Hospital is doing what it can to deal with an influx in demand. But with 115 COVID patients for 111 beds, it's beyond capacity.
With the UK variant, this time Brescia is the area worst affected and the average age is lower in respect to the previous waves. It has dropped to 45 to 50 years old.
Highly contagious variants have created a worrying third wave of contagion. In response, the entire country, apart from the island of Sardinia, has been declared orange and red zones, with schools, bars and restaurants closed until at least after Easter.
The restrictions are fundamental, but unfortunately they arrived too late. They should have been implemented in the middle of February.
To curb the latest wave of infection, in addition to further lockdown measures, the government has pledged to accelerate the country's vaccination campaign, aiming to cover 80% of the population by September. Vaccination centres are hoping to recommence with AstraZeneca as soon as possible.
Here you see a vaccination centre with a potential 1,000 people a day with 8 booths, and we only have 3 booths operational with the Moderna vaccine.
Despite lockdown fatigue, authorities are pleading for patience.